How will you identify facial nerve during parotid surgery? This question will be asked every time when you will get parotid case. It is also very important for surgeons to identify and safeguard the facial nerve during the parotid surgery. So in this video, I'll be telling you all the points and hints which can help you in identification of the facial nerve so that you do not injure them during the surgery. Effective identification of facial nerve, that is the cranial nerve 7th, during parotidectomy is critical to prevent the nerve damage and preserve its function. Various anatomical landmarks and techniques are utilized for correct localization. Some of the key surgical landmarks are: first is the stylomastoid foramen. Stylomastoid foramen is located posterior lateral to the styloid process and anterior medial to the mastoid process. Facial nerve exits here before entering into the parotid gland. It is surrounded by dense fascia, making its direct visualization very challenging. Second and very popular landmark is tracheal pointer. The nerve lies 1 to 1.5 cm deep and slightly anterior inferior to tip of the tragus. This pointer represents a superficial and easily accessible landmark, making it very popular for the surgeons for identification of facial nerve. Third one is the tympanomastoid suture. It is a junction between the tympanic and mastoid part of the temporal bone. The stylomastoid foramina lies 6 to 8 mm distal to end point of this suture. Fourth point is the posterior belly of the digastric muscle. The nerve is located 1 cm deep to its medial attachment in the digastric groove. It serves as a consistent inferior landmark. Fifth one is the cartilaginous external acoustic canal, also called as Schwalbe's line. The nerve lies 7.5 mm anterior and deep to the bone cartilage junction. Sixth one is the styloid process. The nerve is lateral to this structure, though less commonly used due to risk of injuries. Now I'll be telling you some of the techniques for the nerve identification. There are two approaches for reaching up to the facial nerve. The most common one is the anterograde dissection. It begins at the stylomastoid foramina and proceeds along the main trunk towards its parotid branches. It is preferred for primary parotidectomy surgery. However, another one is the retrograde dissection. So this approach starts by tracing the distal branches, for example buccal or marginal mandibular, and then proximally we can go to locate the main trunk. It is useful in distorted anatomy or in case of revision surgeries. A very important and newer modality is the neurostimulation. It's used for confirming the localization of the nerve. Can be challenging, where we use the gamma radiation or the nerve stimulators. Hamilton-Bailey technique. This technique focuses on identifying of the peripheral branches first, followed by the retrograde dissection to the main trunk, which is used in the revision surgeries. So the practical steps for surgical identification is the expose the landmarks. Use retractors to expose the key landmarks such as temporomandibular suture, stylomastoid foramina, and posterior belly of the digastric muscle. Sectioning of loris fascia is by a dissection of loris fascia carefully by bipolar cautery and scissor to expose the deeper structure. Avoid blind dissections. Ensure that glandular tissue is not incised before the nerve identification. Control hemostasis. Manage venous bleeding from the structure like the stylomastoid artery to maintain a clear field. Another thing which can be done for the safe dissection is begin with superficial recognizable landmarks such as tracheal pointer. Maintain consistent depth and direction to avoid the iatrogenic nerve injury. Use gentle blunt dissection to avoid traction or crush injuries to the nerve. In case of anatomical distortion, rely on neurostimulator and multiple landmarks for the confirmation. I am sure this video will help you in proper identification of the facial nerve during the surgery and also while giving the answers in your exams. Do share with your friends so they can also save the facial nerve during the surgeries. For more such videos, subscribe to my channel. Thank you very much.